Awesome.
Yeah.
All right, so we are officially on, but we're just going to wait a few more minutes and let people continue to log.
Okay, sounds great.
And I'm just sifting through all the questions that have already come in. We have a lot of just double questions, so I'm just going to make sure I don't ask you the same question twice.
Okay, sounds great.
The same question, just worded differently.
Yeah.
There's a lot of those. So how was work today?
Fun and busy.
Yeah.
Very busy. It's insane. Just like, because, you know, we just picking up after COVID, it's just going right back in there and we're just getting, you know, slammed.
Yeah.
So it's nice to be busy. Not every office is like that. So it's really, really nice to have a busy office. And, you know, I'd rather be doing dentistry than like sitting around doing nothing. So
absolutely.
It's nice. But
did you guys have any layoffs in your office?
Everyone was furloughed.
Okay, so
everyone came back. Yeah, everyone came back.
Furlough is a big difference from a layoff. That's actually one of the questions that populated here is, did Aspen Dental do any layoffs? So we'll most likely ask that question because there's a huge difference between a layoff and a furlough.
Right, right.
So everyone's back now?
Yeah, everyone's back. So we're back to full strength at my office. And I'm pretty sure all of Teskey offices, I don't think they have anyone laid off.
Good.
That I know of. All the doctors are back, all the DAs, the hygienists. So
that's awesome.
Now. Yeah.
Oh, that's good to hear. Okay. Yeah. We're getting some folks logging in now. So we're just going to wait a couple more minutes and then we'll get started.
Okay.
Those of you that don't know me, my name is Becca Mazer and I'm one of the academic recruiters. And then we will get started promptly in about 3 minutes. And that way we can introduce you and start on some of these questions because we got some great questions, quite a few. So I just want to make sure we get through as many as we can. Cool?
Yeah, sounds great.
Awesome. All right. Have you been taking advantage of the free CE courses that they launched with COVID?
I've done so much CE, but now that I'm working, like, it's so much better to do just hands-on stuff and just actually do dentistry. So I haven't been doing as much CE now that I'm actually working. But, you know, there's like the learning journeys and CE that we have to take in Aspen, like as a doctor from Aspen too. So like getting through that stuff kind of like CE and getting through all that. So haven't done much like other CEs besides the one that I'm assigned to do. So.
Yeah. Yeah.
But I did when I was on COVID break, a lot of CE.
I bet. I mean, we launched that free CE program, which I thought was fantastic because it's available for all the students and just dentistry. And they've extended it through March 2021.
Oh, damn.
Yeah. So that's really cool. It's available for everyone. And I'll mention that again here in a little bit as soon as some more people log in. So we'll be starting in 2 minutes. Okay, so I'm going to continue shifting. So you're going to see me kind of do this and kind of go back and forth because I have all your questions on this side.
Okay.
Okay. So for those of you that just logged in, we'll be starting in 1 minute. And then if you have any questions to pose, please do not hesitate to use the Q&A right at the bottom. I feel like I'm a cool influencer YouTuber when I'm like, use the Q&A down here. I'm not that cool. All right, so we'll be starting in 1 minute. Right. All right, guys, so we're going to get started. First and foremost, thank you so much for everyone that's registered, that's submitted questions, that's logging in live, as well as, posing questions live. My name is Rebecca Mazer, and I am I am the senior manager for the academic and relations team. So we work really closely with the recruiters. We're part of the talent acquisition team. We help with setting up interviews and doing lunch and learns and just making it possible for our students to get in touch with our doctors, setting up shadow days, and just answering questions about possibly joining Aspen. So today we have a 1 hour Ask Anything session with Dr. Amanda Beltrami. We are going to have you introduce yourself, kind of tell us a little bit about your background, as well as a fun fact. Cool?
Yeah.
All right,
Put me
let's
on the
get started.
spot with that one. But hi, guys. I'm Dr. Beltrami. I just graduated from Marquette University School of Dentistry in May of this year. So really fun graduation for COVID because we didn't actually get a graduation, so kind of a bummer. But I've been working with Aspen as a doctor for the last probably month and a half, and then I've been actually before that I worked as a DA with Aspen during COVID because my boss reached out to me and said, hey, do you want to just start as a DA? Because I know you can't travel or do anything fun. You want to just work. So I had that experience then. And then a fun fact about me, I guess it's always my fun fact, is when I was in college, I took kendo, which is Japanese sword fighting, and I actually got 3rd place in the tournament. Fun fact.
That is a really fun fact. That is so random, but that's really cool.
Yeah.
I love that. Awesome. So, Dr. Beltrami, we have quite a bit of questions that people submitted through the online portal. And again, if anybody that just logged in is interested in asking a question live, there's a Q&A box right at the bottom. And you can pose a question if anything pops up during our session. Now, again, this is going to be super conversational. I'm going to ask you some of the questions the students have submitted, and then you can just tell us about your experience. Cool? Awesome. Okay, let's get started. So the first question is, why did you join Aspen over any other DSO and private practice?
Yeah, that's a great question. So for me, starting out, I just knew I wanted to do a DSO because I am not interested in having to manage my own office. I just know that about myself personally. I'm not interested in finance. I'm not trying to do taxes. I don't even do my own taxes, so I'm not trying to do that for an office or manage that. So I just knew I needed a DSO because I needed the support. Because especially starting out, I'm worried more about my dentistry than I am worried about trying to run an entire office and be the boss. So that's why I knew, first of all, DSO. That's why I put private practice off the books just for myself, because I know who I am as a person. And why I chose Aspen? Well, it kind of just fell into my lap, to be honest. I had a friend shadow at Dr. Teskey's office, and Dr. Teskey is the owner for the office that I work at. She owns about 5 practices in the Milwaukee area, 5 Aspen practices. And my friend, she was shadowing there, and she's like, you know what, Amanda, I think this is a really good fit for you because I think you have a very similar personality to the owner. And so I was like, oh yeah, I guess I'm looking for a job. This was in November of my D4 year. So I reached out to Dr. Teskey. I came in and I shadowed her, literally just hung out at her office for one day. And then I'd get a text at the end of the day. And she's like, by the way, I love you. You're getting a job offer.
Oh, wow.
I didn't interview. I didn't apply for anything. I just hung out with the owner and got a job offer. Now, I applied to other things, because you never want to put too many eggs in one basket or whatever the hell that is. So I looked at other offices, of course, just to, make sure I know what was out there. And of the other DSOs, I just didn't have the connection that I had with Dr. Teskey, who owns the practice. So I think that's really, really important that you have someone there who you can see as your mentor, who you vibe with. You have to have similar personalities and similar practice ideals. I would never want to work for someone who's, completely different on views of dentistry, because then you'll start to feel pressured into thinking their way, and you don't want that to have to happen to you. So that's kind of why I chose Aspen. It basically fell into my lap because I spent one day shadowing in an office, and I liked her. I liked the flow. So that's why I picked it.
That's awesome. That's awesome. That's a great story. So you mentioned mentorship. We have a question here that popped up that said, were you offered an opportunity to mentor? And if so, what was that like?
To be a mentor or to be a mentee?
I think were you offered the opportunity, I believe it's to get mentored, to have a mentor.
Oh, yeah. I mean, that's the owner's job. Dr. Teskey owns my office, and she is there in my office. I am the main doctor in my office. I work at the West Bend office, and I am the standalone doctor. So if you walk in any single day, you're going to see me by myself, which is scary. being first thing first out of school, never a position I saw myself in, but now that I'm doing it, I'm completely comfortable within it. You just become a natural. You're well trained enough coming out of school to handle pretty much anything that is thrown at you at a practice. But Dr. Chesky is there on the phone when I need her, if I send her a text, and she comes through my office at least once a week. She's there once a week there to see. So definitely she's a really great mentor. But then there's other doctors within the Aspen family, you know, just within Dr. Teskey's 5 offices. You know, one day I was taking a tooth out, I broke a root tip. Happens to everyone. Broke a root tip, couldn't get the root tip out. I was like, well, am I going to send this guy to an oral surgeon who then has to pay a fee, or we have to reimburse him to go to an oral surgeon to get this root tip out? I called the doctor at the Aspen that's 20 minutes down the road and said, hey, I got a root tip stuff. Would you do me a favor and get it out for me? And he said, yeah, send the patient over. You know,
Awesome.
Stories like this, you're all interconnected, especially when you find an owner that you vibe with. It's as simple as that.
I love that.
Mm-hmm.
Yeah, that's great. I mean, being able to have someone so close by that you can call and say, hey, I need help. That's awesome. That's good. Okay, cool. So the next question is, name a few things that you really enjoy about working for Aspen.
Always being busy. I like to be busy. I can't picture myself. Another reason why I didn't choose private practice, because a lot of the private practice that I shadowed, you know, trying to get into dental school or even just interviewing with private practice in the area, a lot of downtime and a lot of, you know, sitting in their office and waiting for people to come and get them to do things. So at Aspen, I'm always on my feet. I'm literally on my feet for the full day. Like if I get a chance to sit down, that's insane. So I like being busy. I've gotten to do so much dentistry, especially compared to my peers, because I just graduated in May. You know, I graduated in May, and just even compared to my peers, I've lost count of how many teeth I've taken out. Like I thought I was going to have a tally. I probably over 200 at this point easily.
Wow.
Yeah, and I've only been working for a month and a half. So I just feel like I've gotten exposed to a lot more things, more comfortable treatment planning. Just walking in, seeing a pan in the full mouth series and saying, bam, this is what you need. You know, you just get used to it. I'm not going to lie, it's stressful. And you know, it's ultimately my decisions that are going to happen in people's mouths then, and no one's looking over my shoulder. Although sometimes Teskey does. Even when she's not in the office, she'll pull up pans and be like, what the hell treatment plan did you think for this? And I'm like, yeah, you're right. Let's bring the patient back in and reevaluate, you know, stuff like that. So I like.
That's good. Do you feel like you have that connection and you can have that conversation with your owner doctor where you guys can talk about different treatment plans?
100%. 100%. And she's not afraid to tell me that was a stupid decision, that like you treatment plan, like redo it. But she's also not afraid to be like, okay, your treatment plan, you roll with it, you know?
Yeah,
like that.
That's good. That's good to have that kind of relationship. That's awesome. And Dr. Teskey, like you said, owns multiple offices.
Yes.
And she's been with Aspen for many years, and she's definitely a great mentor and someone to look up to. So you got yourself a good owner.
Yeah.
That's awesome. So the next question is, what type of patients does Aspen typically see in their practice, and do you accept Medicaid?
We do not accept Medicaid, okay? Because you can't. It's very, very far and few between offices that will accept Medicaid because you don't get paid. And, you know, we're not in the business of doing dentistry for free. You know, we got to keep our office afloat. And for me, I'd rather just donate my time to a charity dental organization than trying to deal with the headache that Medicaid is. And that's just the flat fact of that's what our nation has for insurances. But the type of patient we see, I would say there's patients very, very similar to what we saw at Marquette Dental School. They're patients that have not been to the dentist in 10 years. There's patients that are cavities on every single tooth. You know, there are lots of denture cases, a lot of people coming in pain. Some people just come in for one tooth at a time. They just come in one tooth at a time to get it pulled. You know, but then we do have the people that are coming in just for routine care that you would see in private practice. You know, they're just prophy fluorides, maybe a filling here and there. But those aren't the patients that get me excited. It's the patients that come in and they're just completely bombed out. And, you know, and we get to start from scratch. That's what really gets me excited as a dentist.
Is that just seeing like the full circle of the end result and how amazing their teeth look after and their
It's the
smile?
full circle of, when someone comes in with just stumps of tooth left and you're able to get a denture, the same day that we take their teeth out, and they walk out there with teeth and they say, you know what, I haven't had teeth in 10 years. I haven't smiled. Now I can smile. And it's those kind of patients that are why I wanted to do dentistry.
That's awesome. Those are usually my favorite. I follow a lot of my just my students that are now dentists and work for us or even work for other practices, and I follow them on Instagram. And it's so awesome when they post the before and afters. I'm not a fan of all like the surgery stuff they post because I'm like queasy about that. But the before and after smiles are always my favorite. So those are awesome. Awesome. So I'm glad you mentioned dentures because we have a question here saying, is Aspen a denture mill? I feel like that's all you guys do.
We're definitely not. I wouldn't say that we're a denture mill, but definitely a lot of patients come to us seeking dentures, because that's where our ads are.
Mm-hmm.
We have a lot of advertisements about our dentures. So we do a lot of dentures, but that's what those patients need, because not everyone can afford all on fours. That's ridiculous. And that's not the Aspen patient or people that are willing to spend $50,000 on their mouth. And that's just what you have to get used to doing is do dentures. And yeah, dentures aren't real teeth, but it's better than what those patients have.
Absolutely. And I think a lot of students also don't understand that we have denture labs. So the lab, the denture work that you're doing is very different than when you were in school, right?
Oh yeah, completely different. Like I have not done a wax up. I would not touch a wax up because I trust my lab tech to do it a lot better than me. And it's nice to have the lab tech there because they'll come in. If I see a wax up that I hate, I grab my lab tech and I say, hey, Brian, come look at this. Do you see what I'm seeing? Can you fix it? And
Awesome.
You just have the instant feedback, which is really nice. And like dentures are not fun. Like doing dentures, how you do it in school, I can see they turned up completely off dentures in school, but doing them in private practice is so much easier. And you actually get the patient dentures in a reasonable amount of time instead of the 2 months that it takes you in school.
Wow. So what would you say is a turnaround for a denture at Aspen?
I mean, if it's an edentulous patient and they walk in a dentulous, we do diagnostic impressions, then we do the occlusal rims, and then we go right to the wax try, and then denture. So maybe 4 appointments. So 3 weeks.
I was about to say 2 to 3 weeks.
2 to 3 weeks, yeah.
Wow, that is awesome. So it's a huge, I think that's the misconception about Aspen being a denture mill is because our turnaround time is so fast that a lot of patients do come to us for dentures.
Yeah. And I mean, we do a lot of dentures, and that's because that's where those patients are going because we have an in-house lab.
Right. Absolutely. So you mentioned that you are working in one of the offices kind of by yourself, right?
Yeah. Yeah.
So one of the questions that popped up is, if you start as an associate, how quickly can you become a lead dentist at Aspen? Are you having that conversation about becoming a lead dentist yet? Or what does that career path look like?
I mean, you can, if you want to do it, you can do it. Right now I'm just an associate, even though I'm in an office by myself, because I don't want any more responsibilities. Doing the dentistry right now is enough for me because there are more responsibilities if you're an MCD. You have
and
to.
What's an MCD really quick? So
I don't know what
an MCD is.
It's like the lead something clinic dentist. I don't know what it is. Whatever.
We have a lot of acronyms, right? So MCD, for those that are, before someone poses that question, because they do, what's an MCD? Is a managing clinical director.
There we go.
So basically the lead dentist.
Yeah. Yeah.
Okay.
So, I mean, if I ask my doctor, right, my owner right now, if I could be MCD, she'd probably say yes, if I wanted it. I started as an associate because it's a little bit less responsibilities, but I know a doctor who works in Waukesha that started as an associate, and then she was put in her own office, and like literally she asked, I want to be MCD, bam, she had it. She's MCD now, and all she had to do was ask.
That's awesome. I mean, that's the kind of nice thing is that I think you can kind of choose your career path, right? If you want to come in as an associate and build yourself up and build your hand skills, and then transition to that lead spot when you're ready.
Mm-hmm.
These are there. But like you said, right now, you just don't feel like you're ready yet. You want to focus on your dentistry first.
No, I just want to try to get my crown preps down to like 30 minutes. That's where I'm at.
Awesome. So that's a good leadway into this question here. It says, do you have a certain amount of time that you get per case or per procedure?
It's whatever I tell my front desk to schedule as, so I get full control over my schedule. And that is the one thing that I'm really struggling with my office right now, is because the dentist that was there before me, they have his schedule ingrained in. So like every single time I'm like, I need more time on this. So I've been kind of bad at, because I have to watch my schedule like a hawk and be like, I can't do this in an hour. You have to give me 90 minutes. And like, if I tell them, they'll push things, but it's trying to get them to schedule how I want to get them scheduled, and they'll do it. It's just they're stuck on the old doctor's time frame. So it's just, that's the one hurdle I have right now in my office, is getting the scheduling right. But if I need more time, they'll give me more time. You know, they just have to remember when they schedule patients.
Awesome. So that's just a conversation that you have with your front office, saying,
With my front desk. Like if I see like something where they want me to do a full mouth extract in 1 hour, I go up and be like, this is ridiculous. You've got to move someone and give me more time.
Okay, good. So just open communication.
It's just about communication, you know, and setting your expectations. Like day one, they had this sheet that I had to fill out, like how much time do you need for one single filling? I'm like, okay, 30 minutes. And you fill that out and then they have that.
Okay, good. So you kind of set your own time and what you feel you're comfortable with.
Yes, exactly.
Awesome. So one question that popped up here is, how long did it take for you to transition up your speed once you started working after dental school? So I guess that kind of goes hand in hand with what you were just talking about.
I mean,
so do you feel like you are in a good place speed-wise, or are you still kind of building up to that?
Oh, no, I am still building up to that. I am definitely, that's my one thing to work on right now, is speed. Because I'm not a fast dentist. I wasn't fast in dental school. I'm not fast now. You know, it doesn't just magically you get out into the real world and you're fast. That doesn't happen. So it's something that I'm working on, you know, and trying to get more comfortable doing things fast, figure out what kind of shortcuts I can take to do things quicker, but also with the same quality that I'm used to and to uphold in myself. So that's, yeah, I'm definitely not there yet, but I've only been out and practicing dentistry for a month and a half. So, you know, compared to where I was in dental school, you know, where you saw 2 patients a day, you know, I'm seeing 6 patients a day, you know, so that's
Right.
an increase then, you know. Awesome.
So we have a question that just popped up live. Let's see here. What does it say? How did you decide between corporate and private practice? How did you decide on Aspen versus other DSOs? And did you interview with any other DSOs? That kind of goes with what you were saying earlier, kind of fell on your lap. But yeah. Did you interview with any other DSOs?
I did interview with a couple other, and the one other that was like actually I actively like talked to, they wanted me to start a brand like scratch office. And I knew I did not want to do that. I was not comfortable with that. So that's kind of why I went to Aspen, because I wanted a little bit more, I wanted to be babysat a little more is what I thought, you know, kind of like that, just knowing where I was with my skill level.
Good, awesome. Another live question that just populated. I'm sorry, I'm clearly blind. No, my screen is on bright, so I'm just trying to like really zone in on this question. So this populated, is there anything you wish you would have known while you were looking for a job before you started working for Aspen?
If I was looking for an office?
Is there anything you wish you would have known while you were looking for a job before you started working for Aspen?
Honestly, COVID changed the whole game. Completely threw a wrench in everything, because dentistry as a whole is kind of faltered and stopped. So the choice I made turned out to be a really good choice for me through COVID, you know, because I have a job. I started early. Some of my friends still have not started yet their job, you know, so I made a good choice. But I think the most important thing is that I can't stress enough having the connection, making sure you have a mentor there that is willing to help you, lead you, not make you look like an idiot in front of patients, but also bail you out if you need to get bailed out.
Right. No, that makes perfect sense. And I'm glad you mentioned that. because we do have quite a few, students that we were interviewing and decided to go with a private practice or with a different DSO. And they're coming back around and they're saying, hey, I haven't started working yet, or my position kind of fell through. Do you have any opportunities? So do you have some friends that are still kind of like figuring out what's the next step for them?
A lot of them are, but I feel most of them are cemented now, but they're just late starts. They're not starting until September, which that's a long time to be sitting around where you can't even travel or do anything fun. You're just sitting in your apartment and waiting. And the longer you wait, the rustier you get.
Right.
You can't practice at home.
That's wild. When did you start again, Dr. Beltrami?
Literally, my boss texted me and it was the Thursday before Memorial Day saying, hey, I think you're probably sitting around at home in COVID and really bored. We're opening our office, because that's when Wisconsin reopened, was like the day after Memorial Day. Do you want to start as a DA? Because I know you don't have your license yet. Because I didn't. I wasn't even, I just graduated a week ago technically. Right. So I started as a DA. I started working at the Waukesha office. I was still introduced as doctor. Hey, this is doctor. She's just following me around. She's going to be helping me in such name. So that's what I did. I did that for, about 3 weeks as I waited for my license to come through, because it takes a little bit after you graduate for that to actually process. So it was nice, even though, I was just a DA, but I was still getting out of the house and doing something.
Right. So, and you were kind of getting your feet wet in the office and just kind of getting acclimated.
If you have the opportunity to do that, I wouldn't be a DA in the office you're going to work at, because how weird would that be for patients to be like, you're the assistant and now you're the doctor. But I worked at a different office. I still got to learn the computer systems, and it was completely low stress then, because I wasn't doing the dentistry. I was suctioning. You can't get any better than that. And it was a great way for me to get back into dentistry, because at this point I hadn't seen a dental chair in 3 months.
Right. So that was a really good opportunity for you.
It was very good. And my boss was so for that, because she's like, I just want to get you used to things. And literally I got my license on a Monday, and then the Tuesday I was doing dental work. So she's like, awesome. The second you get your license, we're putting you to work and you're doing dental work. So
it was a quick transition.
It was a quick transition. It was a little scary, because the first thing I did back was a crown. So I was just like, okay, do a crown right away after not picking up a handpiece in 4 months. So
I love it.
It worked.
That's good. It worked out. So we have a live question that just popped up, and it says, do you wish you would have done an AEGD or a GPR?
Not at this point. There's some really cool ones out there. So maybe a really implant heavy one would be cool, because I'm definitely not doing implants, because, I'm focusing on just my dentistry right now. But if you're thinking about it, maybe put some research into it. But for me, it was basically, I just wanted to get out there and working. You learn so much on the job. I am so much more comfortable doing just dentistry, extractions, crown prep, stuff like that. Where if it wasn't an AEGD or a GPR that was specialized in somewhere, I don't think it's worth your time, because these are skills you can pick up in the office. But if it's something that specializes in learning how to do sedation dentistry or implants, that's something where maybe it's a good idea to do if you're interested in learning how to do it. But at the same time, there's always CE courses that you can take and learn those skills later on once you get your dentistry down, which was kind of my plan. I fully intend on doing implants and stuff like that down the line. I just want to be a good basic dentist first before I try to add on anything fancy.
Yeah, I love that. And I'm glad that question popped up, because we do have a lot of dentists that come work for us after their GPR or after their AEGD. And you mentioned, I feel like I've learned more in 3 months working at Aspen and seeing patients and seeing all these cases than I did in my 1 year in residency. So, I think that's a great point. If you're going to specialize in something, then definitely jump in. But if you really want to get your feet wet and focus on just different cases, to each their own, but I feel like I hear that a lot of our students that came straight to work, have compared, what they've done with their friends that went into GPRs. and they've done just as much or maybe even more in the same amount of time or less amount of time?
Yeah, I have two really close friends in GPRs right now, and I can definitely say I've done more than them.
Wow.
I can definitely say that I've done more than them, but you know, they're not in specialty GPRs, so.
Okay.
Mhm.
That's good. That's good to know. So guys, if you guys have any other live questions, I mean, please feel free to type them in and I'll answer them as they come. So another question that was populated was, what has been the hardest adjustment in the real world after dental school?
Managing multiple columns, managing your columns. I'm sure, I don't know if how many of you guys are from Marquette, but you know, that class that we took that was like the business practice class where you have like, this is your production column, this is your hygiene column, and you need to stagger your A and B, and it was the most boring class. It actually matters in practicing, so you should have paid attention because I definitely didn't. But managing columns, because like I'm the only dentist, and the way Aspen does their chairs are, you have your production column, and that's what you're doing, like your fillings, your extractions, your crown preps. That's in your production column. Then at the same time, you have your hygiene column. Now for hygiene, you're not doing exams for every single patient there because a lot of them are like SFPs. So you already looked at the patient and you don't need to do another POE. They just had their POE. But you do have to pull in there sometimes to do like 6 months and when if it's their annual POE. So, and then the third column we have is our overflow column. And that's kind of different than what we taught, is that there's a third column, but that's the steps where you're not as involved, but it's where your dental assistants come in and they do a lot of the stuff for you. So like Invisalign, you really don't need to be very involved in Invisalign. It's a scan. We all have, in my office, I have an iTero scan. I iTero scan every single patient and do a lot of Invisalign. I'm Invisalign certified. That was one thing off the bat. My owner was like, we're getting you an Invisalign certification so that I can do that. And it's not really a heavy knee thing because like the assistants can put on the attachments. The only thing I have to do is the interproximal reduction. So that's something where I only need to pop in and say hi for a minute and then, you know, leave. So that's how it matters, but you still have to be seeing all these patients at the same time.
Right. So you're just managing your time and managing the different columns has been your biggest adjustment.
Managing the columns. Yep.
Awesome. All right. So here's a good one. Geographically speaking, did you wind up working somewhere that you wanted or did you have to move?
I wanted to work in Milwaukee. So before COVID, I originally was supposed to be the second doctor at the Brookfield location. And that was like the plan. They were going to put me as the second doctor, and then COVID happened. But luckily, my boss was able to put me into the West Bend office, which isn't that far away from where I was supposed to be working. And because she had an opening. And she's like, you know what, I really want to keep you on part of the team. Because at the time, you couldn't afford to have two doctors in one office. Right after COVID started, there was no way because we did not have the schedule. We were just off. You know, we didn't make money for like 3 months because we were shut down. So, but luckily she was like, I have a spot for you. And so it's kind of nice being by myself though, but I definitely am in the area I wanted. Though I mean, I had that connection though. So not everyone has that connection. So some people I know have to move that work for Aspen, you know, when they get their job, but every case is different. I didn't have to.
Right. That's awesome. I mean, the great thing is that we have so many offices and so many locations that if you want to work in a specific place, then mention that, right? But if you are open to different opportunities and, you know, more pay or relocation, or, you know, if you're interested in student loan reimbursement, there's a lot of other locations that offer different type of stipends.
Mm-hmm.
But I'm going to be realistic, like places like Milwaukee or Chicago downtown or Miami and California, like these places everybody wants to be there.
Mm-hmm. Mm-hmm.
So we have an influx of candidates and influx of students that apply for those. So the more open you are to a location, just the better options and opportunities you're going to have.
Yeah. Mm-hmm.
Awesome. Okay, we have quite a few more to go. So you mentioned implants. A question came in saying, I really want to do implants. Does Aspen offer implants? And if so, do associates get certified? what's your current situation with implants or your current experience?
I'm restoring them for sure, not placing them. I know Dr. Chesky would love me to place them, but that's kind of unreasonable right now with the amount of skills I have. We do have a lot of CE. So I'm actually taking CE right now where I have to learn how to place them and restore them. And that's just like to be implant, like just one of those CE classes that I need to tick off my list of CEs that my boss wants me to do. But I mean, it's good CE is interested. I know that one of the other dentists who places implants in the practice, she went on like a CE, like in-person trip where she was like there for a week, and it was like a deep delve into it, and that's how she learned implants. And but there's not really an implant certification, you know. I mean, maybe based on like if you're Nobel certified, you know, if you go through Nobel and take their classes or something like that, based on what system.
Right. We, so like you mentioned with Invisalign, we had that huge overhaul where we wanted to offer Invisalign in almost all of our offices. So then we had the iTero scanners put into all the offices, and we trained, basically everyone to do Invisalign and got everyone certified. So implants are our next overhaul. We had this huge plan for implants, and then COVID happened. So we actually have, have you been to our downtown Chicago training center yet?
No, not yet, because I haven't done it. Haven't been able to do Edge.
Okay. So when the world's back to normal, cross soon, we send our doctors to Edge, which has actually just been shifted to like a different doctor development program. But we are going to be offering implant training and all that good stuff. So hopefully if you decide you want to do implants down the road, you'll be able to attend that.
Oh, great. Then I'm signing up now.
Yes. So tell Dr. Teskey that once this world's back to normal, you want to go do your implant training. Yeah,
I'm sure she'll probably sign me up and not tell me until the day before, and then be like, by the way, you're taking
going to Chicago. That's awesome. Yeah. So we do offer tons and tons of CE courses. So for those that are asking about CE, there's actually a question down here as well that says, how much money towards CE does Aspen offer? Was that written somewhere in your agreement that you were offered a certain amount?
No, I mean, it's just, here's the Aspen's catalog. You get to do whatever you want with it.
So I want to say they're all free.
Yeah.
So there's no, and the only reason I mentioned that is because I used to work for a DSO that said you only get $1,500 towards CE every year. And then that was like a reimbursement, right? With our CE online, it's unlimited, it's free. Whatever shows up that's free, you can take. And if there are in-person courses like Invisalign or implants and things like that, typically you can negotiate that with your owner and see if they're willing to pay for it, and most of the time they are, and then you just pay for your hotel or for your travel. So
I mean, the owners are very reasonable. If you say, hey, this class will make me a better productor and like a better dentist, don't you want me to take it? They're going to say yes.
Absolutely. I'm glad you said that, because, our owners are very, obviously they're very reasonable, and they want whatever's going to help the office do better and help you, produce more and be a better dentist. They're all about sending you guys to training. So that's fantastic. Awesome. So next question, does your office offer specialty?
We have an oral surgeon that comes to the 5 offices. He doesn't come up to West End because it's kind of like right on the edge of like up in the middle of nowhere. But he does come to like the Brookfield and the Waukesha and the Madison locations. So there is an oral surgeon. So if I see someone with like, horizontally impacted thirds, I'm not touching that. I'm going to say, hey, we can get you scheduled with Dr. Nellen, who's our oral surgeon, to get him out. So we have an oral surgeon.
Okay, good. So for that question as well, guys, we do have oral surgeons and we have endo. So some offices need it more than other offices. And like you said, your oral surgeon just kind of hops around to different offices. And then you guys just fill the schedule, right?
Yeah.
So, and you don't have an endo?
We don't have an endo, but I can refer to, there's doctors in my area that I refer to that I like.
Awesome. I'm getting a pop-up a question on, someone just texted me a question. They're saying that the questionnaire is giving them an error, so.
Oh no.
Okay, I just send it over to my list. Let's see if it populates down here. Okay. Do you have a quota that you have to meet with Aspen? So talk to me about your like metrics or quota. What is that? I mean, is there a quota?
I mean, not for me to produce. Like the office has a budget goal that, you know, if my office, you know, it's our goal to get this much, and it's incentivized because I am making a percent on production. So like I'm incentivized. They're not going to pay you to sit around and do nothing. So you got to do dentistry, and it's you're incentivized to make more because I'm going to make more money that way then if I produce more. So that's always nice to make more money. But our offices do have a budget goal and like a run rate that we like to hit. But like if we don't hit it, it's not the end of the world. You know, like especially coming back from COVID, is getting back into the swing of things. But obviously you're going to want to hit it, because if you're not hitting it, then your owner is probably going to be like, what are you doing? They're not going to keep you in the job if you're not making money and hitting at least the run rate.
Awesome. So, I mean, that's a great question. And I'm glad that you mentioned that, because again, I've worked for another DSO where they had a quota and a metric where they had to hit a certain amount of production, or they had to hit a certain amount of revenue. So, talk to me a little bit, and I have another couple questions that just popped up live, so I'll get to those right now, guys. But talk to me a little bit about our pay structure is a little bit different than everyone else, right? And we focus highly on our patient satisfaction. So I would say, is that the only thing that really negates like a quota or some sort of metric, is making sure that we are having a really good high patient satisfaction?
I would say, yeah, that's probably the most important, is our patient stats, like making sure that they leave and they're leaving like good reviews and good numbers for that. I would say that's pretty important. But I mean, you don't have necessary hits. Like you don't have to hit certain things. It's just ways to keep track of things. And then if your doctor is noticing that you're lacking in something, they're going to help you. If you're not hitting your like expected budget in the office, they're going to help figure out what's going on in your treatment planning, because there's plenty of patients. That's the thing about Aspen. We have plenty of patients. There's so many patients in need that you don't need to worry about that. It's going to just fall into place. You just need to make sure that you're doing dentistry and you're doing things that make sense for treatment planning.
Awesome. So speaking of treatment planning, we just have a question that popped up. Requirements for Marquette endo are limited. Do you feel comfortable doing endo?
Not on molars. I have referred every single molar. I've done literally one endo since I started, and it was number 25, and it was amazing because I got to do warm vertical, so I did not have to stick all the little cones in. It was like this one cone, and you put it in like a little oven, and then once it was ready, you just like shoved it down the canal, and then it was it. That was it. It was done. I did not have to shove all the little tiny cones in there. It was the most magical thing of my life, and it worked really well. But that's literally the only endo I've done. So I would say I'm not ready for endo. That's why I have my endo referral. I refer probably at least one root canal a day. At least one root canal a day. Because, you know, I'm seeing new patients, and a lot of new people come into Aspen in pain, and a lot of those are for root canals, which I'm not comfortable doing. And that is one thing for Marquette, that they don't prepare us for that.
I want to say that question popped up here somewhere. I'm gonna have to find it, but do you feel like the procedures that you do are based on your comfort level?
Oh, 100%.
Okay.
100%. Yes. I'm never asked to do something that I'm not comfortable with, because it's, first of all, a waste of my time because I'm going to be slow, and a waste of, you know, the owner's putting me to do something. Like the only person that would ask me to do something would be the owner. Like the front staff isn't doing anything like that. You know, they come to me, say, hey, like, what do you want to do? You know, because they don't know. So they come and ask me. So no one's pushing me. The only one that would push me would be the owner, and she knows not to, because she knows I'm better suited doing things that would make money, which is not something I'm not comfortable with.
Right. And do you feel, so you feel like you have full autonomy, you have the full comfort level to do whatever you feel is right by the patient.
Sometimes I feel like I have too much autonomy because I'm by myself, and sometimes I wish I had someone looking over my shoulder and be like, what are you doing? But, you know, that's what it is to be a dentist by yourself, you know, and it's crazy because I can do a filling in like 10 minutes, you know, where at Marquette it would have taken me 2 hours, you know, waiting in that line to get doctor checks. So.
Yeah, that's awesome. I mean, the great thing is that, like you said, full autonomy is huge, right? So you want to make sure that you feel comfortable doing whatever cases you feel comfortable and you're not feeling pressured. So that question that populated about endo, if you're not getting the proper training in school, you're not going to feel pressured doing those procedures while you're
No, never. And first of all, doing molar endo, it takes too long. You're not going to make return on the hours. You know, it's not worth enough money in your schedule for the amount of time that it takes you to do.
Right. So anytime you feel uncomfortable, or if it's a case that's just too difficult, you're just able to refer that out?
100%. 100%. You can refer it out. And I've never had my owner doctor like saying, like, why did you refer this person out? Never. She has never asked me that.
Awesome. So one question that populated was, what kind of cases are coming in now? So do you feel like you're seeing the same type of procedures?
Honestly, it's a lot of the same. Because it's right now, post-COVID, it's a lot of emergencies. We are still catching up on our COVID emergencies. It is the people that are just like haven't been to the dentist in forever, and like now all of a sudden, since the entire world is shut down, their tooth starts hurting. So it's been a lot, and it's really in the population where my Aspen is too, is that I'm in a little bit more of a rural. It's like right on the edge of like country. So we have a little bit of a lower dental IQ, just because of the area that it's in. So it's a lot of people coming in just for like single extractions and stuff like that, which is, you know, it's my goal to try to educate everyone that walks in my door, like, hey, you just can't come in one tooth at a time. Like, we actually have to treat cavities before they get to the point where we can't do anything about them. So, but
You
every
have,
office is different.
oh, awesome. So one of the questions that came up earlier too is, are those do you have to have those conversations with your patients when you're treatment planning, or do you have the support staff of like a consultant that goes over, you know, the treatment plan and the cases, or do you do that on your own?
I go over clinical treatment. I do not want anyone explaining my clinical treatment to a patient because that's my treatment. I mean, I have my DAs who know a little bit more about dentistry, and they're trained to look at, you know, an x-ray and be like, hey, just giving you a heads up, I'm seeing some bone loss. Doc might be talking to you about periodontal disease. Or, hey, every patient comes in the door, we know we do a full series x-ray, the pan, and we do an intraoral iTero scan. So, I mean, the patient has their teeth right there, and they like playing with them and rotating them so they can look at their teeth. So like the DA will point out, hey, do you see this tooth? You're missing half of it. Doc might talk to you about putting a crown on it. You know, the DAs are trained to do that. My hygienist goes in, and I put all the perio on her because I don't want to talk about perio. So she talks about, you know, hey, do you know that you have 50% bone loss? You know that you need to be doing scaling and planing. Look at all this calc that's on your teeth. So she talks about that. And then I come in and I get all the information, you know, do my comp exam. But then it's on me to talk my patient through, like, hey, you have bone loss, we're doing scaling and root planing. Hey, we need a crown on this broken tooth. Or, hey, do you know that you've lost 75% of your bone, all your teeth are hopeless, and we have to put you in dentures? You know, that happens, but I'm talking them through the clinical stuff and explaining that to them. Then at the end of that, I grab one of my girls from my front desk, I bring them back and be like, and I explain to that person in front of the patient, so the patient can hear what I'm telling my front desk, like, this is the treatment I'm prescribing. I'm prescribing scaling and root planing, fillings, a cavity, Invisalign. And then the front desk brings them up and talks to them about insurance, money, and scheduling.
Okay, so you focus on your clinical.
I only talk about clinical, and it's the most freeing feeling in the world when a patient goes, how much is that going to cost me? You say, hey, I got someone who's going to talk to you about that because I don't know the cost of anything.
Right.
Awesome. I have no clue what anything costs.
No, absolutely. So one of the questions that popped up earlier as well kind of focuses on your staff. I know you mentioned when you're in dental school, things took so long because you don't have right? The proper help, or you don't have any help. You're kind of doing everything on your own.
Mm-hmm.
So talk to me a little bit about your staff. Who's on board? Do you have hygienists? Do you have expanded service DAs? Like, what does that look like?
Yeah, so in my office, I have my front desk staff, which I have my office manager. She's absolutely amazing. I'm very lucky to have her because she actually used to be a dental assistant. And Aspen does a thing where they like to hire from within. So they like to, I don't want to call it grooming, but they like groom people almost to like get them up the ladder for stuff. So she started with Aspen as a dental assistant, and now she's office manager. So she is a great person because if I am frustrated, I will come to the front and I will just yell at her like, Katie Jo, do this denture adjustment. I don't have time. And she'll just do it, which is really nice. So she's in charge of my office, and I have a couple of people manning my front desk who can also do consults with patients, talking to them about insurance and finances, and they're really great. I have my hygienist who is just she is exactly what you think of when you think of hygienist. I don't know how many Marquette people are on here, but she's a hygienist. She knows all about hygiene and knows everything and is old school, so that's kind of nice. And she does a really good job at treatment planning and like picking up. She knows what I'm going to treatment plan too. So she like will come in and be like, hey, I'm seeing this. I know you typically do this. And then I say, yes. So she can set up patients for me, especially with getting people to do Invisalign, because she'll see things and be like, I'm seeing you have a lot of crowding. How are you cleaning your teeth if you have crowding? We need to get you an Invisalign, stuff like that. And then I have my assistants. I have a couple of newer assistants, but they're smart. So that's good because they're picking up things really quickly. I have my one lead assistant who actually is going to be applying to dental school this cycle. So that's kind of nice because he's very into dentistry. So that's great.
That's awesome. So you mentioned earlier that the reason you chose this DSO, or the reason you chose to the DSO route, was because you don't want to do any of the back office stuff or any of the money stuff, right? So
no. I don't want to try to figure out what insurances to accept and what not to accept, or like how to collect money from people. Like I know a lot of private practices do have an office manager that does handle that kind of stuff, but you still need to look over the books because it's your paycheck in the end. You have to dot their T's and cross their I's, whatever, to keep track of, to make sure they're doing it. Because at the end of your paycheck, that's not my job. I'm getting my paycheck and I'm getting my percentage. There's regional managers to make sure that the office managers are handling things correctly.
Awesome. So one of the questions that populated was like, what level of support is there in your office? So you mentioned a regional manager, and then you mentioned, the front desk girls and obviously your DAs. Tell me a little bit about your office structure. So obviously you're not dealing with insurance, right? You have people that do all that for you.
No. And I mean, they all, like, I would say I'm the boss because I'm making all the decisions, and everyone comes ask me my preferences and stuff. But in the end, if there's a patient that I don't want to deal with because they're grumpy, I can walk out of the room and say, let me get my office manager. And we have a regional manager who handles a lot of patients and stuff like that. But for an example, today I had a patient come in who thinks he was allergic to the monomer in his denture. So he was complaining of a denture allergy, which I have never seen before. I've never seen that, never heard of it. Maybe it was a footnote in a lecture somewhere, but I didn't know what to do. So I went to, well, first of all, I texted my owner and be like, what do I do? And my owner said, reach out to the head, Brandon, whatever his last name, the head lab guy for all of Aspen. He's like one of the lab guys. She's like, just shoot him an email and see what he says. And so I did. He's like, oh, yeah, that can happen. People can be allergic to their denture. What you do is we need to make him a hypoallergenic denture, which I've never heard of.
So he wasn't lying.
No, he wasn't lying. He was allergic to his denture. And I got that answer probably within 15 minutes.
Awesome. So you have a great support staff. So if you don't know something, you can reach out to your regional or your office manager, and there's a ladder of networking around you.
There's a ladder of people to ask, and actually Jen Troxel was in my office today with the mystery allergy guy, and she immediately whips out her iPhone and is like, let me call Frank for this. And she like dials Frank, who's like the head lab guy, and like gets him on the phone. And he's like, well, we can do a allergy skin test. I'm like, I'm just going to make him the hyperallergenic denture. I'm not dealing with trying that. So it was kind of
Awesome. That's cool. That's nice that you have such, an awesome support staff. So speaking of support staff, a question here that populated was, what is the Aspen culture? We hear culture all the time. What does that mean to you in your office?
In my office, I'm younger, because I just graduated. Like, I'm 26-year-old, and going in this office, everyone called me Doc, which I think is so funny because that's like an old guy name, like, hey, I'm Doc. They all call me Doc though, and that's what they do. But they're very respectful. We all are in the mindset, especially because our office, I'm kind of competitive, and we do a lot of competitions within the 5 offices that Dr. Chesky owns. So, and that office was running at a negative for a little bit. And so I'm trying to pick it in, and I want to get us into the green, get our books into green, try to do as much production as I'm comfortable with, and trying to run with it. So it's that culture of doing everything together. Everyone likes it. A lot of my DAs are young. I would say everyone in my office is pretty young, except for our hygienist who knows it all, which is nice to have that one all-knowing person.
Is she like the mom?
Yeah, she's 100% a mom. She's 100% a mom. But they're all very respectful. It was kind of worrying for me just because I am younger that they weren't going to treat me respectfully, and they were just gonna be like, oh, this dentist doesn't know anything, because to be honest, I'm new. But no, they're there to support me, and we try to have fun. And some days the ship burns. Some days you have a terrible day, but at the end of the day, we get out of there and we laugh about it and say, what, tomorrow's going to be better.
Oh, awesome. So you have a little mini culture in your office. And
oh yeah, for sure.
Do you agree that you as a doctor, even though you say doc is an old name, you earned that title, right? You are Dr. Amanda Beltrami. You've earned it.
Yes.
So you definitely are the one that kind of leads that office, since you're there by yourself. So
100%, yes.
You create your own culture in that office.
Oh yeah, there's definitely culture. You create it. Whatever your leadership is, they're going to see that and follow that. I'm not going to say there's not bad employees at Aspen, because there's definitely bad DAs. Not every DA you pick up is going to be like an amazing, lead DA like what I have in my office. So there's definitely people where sometimes you have higher DA turnarounds, which really can affect your flow. But once you find the people and, stick with them and get them to learn, it's good.
Absolutely. So we have just a few more minutes left. So I want to touch on COVID, because we have quite a few questions that populated about COVID. I've been seeing a lot of the Smile Wide, Smile Safe campaign. Talk to me a little bit about, how you guys are handling COVID. Because one of the questions that came in earlier was, are you worried about PPE shortage? And what steps are you taking to make sure that the doctors and the hygienists have the appropriate protective equipment in the offices?
We definitely have a lot of PPE. That is the one good thing about Aspen. We're big enough where we have all the connections, we have the contracts with all the suppliers. And when I took basic econ in 11th grade, it was term I don't want to call it the Walmart effect, but it's economy of scale. That's the fancy word. So we have enough buying power where we can actually get the PPE. And I have a friend at a different office where they didn't have they didn't have surgical caps for her. So she had to go and buy her own surgical caps. We have them. Yeah, they're old lunch lady looking things, but at least we have them. They're not cute, but they work. We have definitely enough PPE. So it's not an issue of PPE shortage at all for Aspen, at least in my office. I have my N95 masks. I have my surgical masks on the top. I have my full gowns and my little lunch lady hats and gloves, and I have everything.
Good. So you feel safe?
Oh yeah, 100%.
Awesome. So the next question was, do you feel that Aspen was prepared to protect dentists during the reopening of the offices? after COVID. So you said you started literally right after COVID hit, right?
I did. Like I started as a DA that day that Wisconsin opened. And definitely, I mean, they took everything like the CDC had to say to heart. I mean, the only real thing is that in the Aspen designed offices is that we don't really have doors. Like I have in my office, I have one op with a door. So for aerosol procedures, that becomes like the aerosol procedures room. And that's where you have to do it. Otherwise, we've been like spacing our ops out for aerosol procedures. So keeping them within like this, you know, a 12-foot safety ring. But every office is designed differently. But I know just in my office, we only have one door. So it's just how the office is designed. So, I mean, that's probably how everything's going to change in office design soon. You know, they're going to put doors on every op now.
Right. And I feel like it's just, you're just kind of rolling with the punches. You're taking it as it is. COVID is kind of, it was very random and it hit and you just had to prepare for it.
Yeah. And I mean, all the rules are changing every single day. Everything's changing every single day. So who knows what tomorrow is going to be.
Absolutely. So with the patients that are coming in, the question that just came in was, how are you handling these patients in your waiting room? Ever have multiple patients waiting at the same time? Are you taking temperatures? What is your current protocol that Aspen has put upon you guys with your patients? Yeah, so we always call every single patient before they come in so they know what's up. They know, like, you gotta bring a mask when you come in the office, so you're wearing a mask. We take temperatures at every single person when they come in. We do have the screening form that the CDC made that asks like the questions like do you have COVID? Do you know someone that has COVID? Like all that. We do that screening form, take temperatures, and ideally we got rid of all the chairs in our waiting room. We have one chair in one corner and one chair in the other corner, and they're like 12 feet apart, probably closer to 20. And there's no people in our waiting room anymore. The patient comes in and they're immediately walked, like once they are screened and temperature taken, they're immediately walked to the back. We make them wash their hands. So they wash their hands, and then we make them gargle with mouth rinse, a peroxide mouth rinse to try to lower viral load. And they just get seated immediately. So there is no waiting rooms anymore. And people aren't allowed to bring other people. It's like you're not allowed to bring your wife to look at your denture. That's not a thing anymore. Right. I mean, I went and got my teeth cleaned not too long ago at one of our one of our local offices, and I felt really safe. I felt, they made me call right ahead before I showed up. They had to take my temperature. I had to fill out a questionnaire, and there was tons of PPE. The office was like 55 degrees. Are you experiencing that?
My PPE right now is I have like literal trash bags to wear. So I do an extraction and I am drenched with sweat because that's just, you can't get the gowns like you used to. But it's hot.
It's nice and comfortable for you guys.
It's hot. It's comfortable for the doctor. Well, not comfortable because I'm sweating.
Yeah.
I feel like I'm Rocky trying to lose weight.
Well, as long as you're safe, whatever you have to do to stay safe.
Right, exactly. That's more important. Like I'll be a little uncomfortable and sweaty, which is fine.
Right. I love it. Okay. So we have time for one more question. So, I know that you said with the openings, a lot has changed, right? With COVID, a lot has changed.
Mm-hmm.
So do you feel that, patients are picking up? Because the question that populated is, how many new patients are you seeing per day? And how long do you have to see each patient?
New patients a day. My office is a little bit slower for new patients because, I've had when I was training, I worked at like all the offices. So I trained side by side with Dr. Teskey, and I just followed her schedule, which was popping to every single office, like one office a week. So, I did get quite a number of miles on my car during training, going to all the different offices. But on an average day, I probably see 3 new patients a day, 3 or maybe 4 new patients a day, which is pretty standard. We get 1 hour total for the new patient exam, but I mean, if I go over, I go over. They're not going to be like upset with me. Well, some people are. Some people are upset when they're like, why is it taking so long? It's like, well, your mouth, that's why. But you know, I'm really only seeing the patient for maybe 15 minutes of it, because the DA comes in, they take all my x-rays. Taking x-ray takes about 15 minutes, you know, for a full series in a pan, 15, 20 minutes. Then they get to see the patient. Then they do the iTero scan. That takes about 5-10 minutes to get a full arch scan of both arches, just so we have a record. It's really nice because that acts then as your model, you know, so you know what they came in, what they look like when they came in. Then my hygienist goes in, and she probably takes like 15 minutes, full perio charting, explaining perio treatment, all that jazz. And then I come in with my exam, and I maybe take another 15 minutes, 10-15 minutes to look at everything and explain to the patient. And there's your hour right there. Then you walk the patient to the front, and they get to talk to the front desk about scheduling and
I love it.
Mm-hmm.
I love it. So I'm so glad you were able to jump on with me. We had just a couple other questions. A lot of them were just repetitive. So I feel like we had a good chance to answer tons of these questions and the few that came in live as well. Thank you so much for being on.
Yeah, no problem.
You were fantastic, and I love your sense of humor.
Oh, thanks. Thanks. It was a rough day today, so you have to think at the end of the day, like, good.
I love it. I love it.
I'd rather have a rough day.
No, I'm sure. And like you said, it was a busy, crazy day. So I'm
It
glad
was.
that you got to take some time to kind of relax and answer some questions that your classmates had. If you don't mind, I'm going to share your information with those that registered, just in case they want to reach out to you. Is that cool?
That's fine. Yeah, they can
Awesome.
email me.
I love it. So thank you again for logging in. For everyone else that registered, thank you so much for joining us. Any additional questions, don't hesitate to shoot me an email. I will be sending you guys an email, and I'll also be sending you guys links with that free CE that we talked about. Take advantage, right? Like you said, Dr. Beltrami, you were bored at home during COVID.
So bored.
And you took tons and tons of CE classes, and this is just a great opportunity for for our students and for anybody in dentistry to take advantage of those free CE courses. So I'll shoot you guys that information, and again, if you have any questions or anything that we didn't get to answer, you can message me directly. But that's it, you guys. Thank you so much for coming in, and hopefully I'll see you on my next webinar. All right, thanks.
Bye.
All right, have a great night. Bye.